So nice to be with you all. We're going to light the chalice now, and my daughter, Lisa Biddle-Puffer, will do the lighting. As we gather in this time of uncertainty, full of unknowns, the angst closes in among us. We light this chalice with a flame that draws us together. With this flame, we cut through the darkness of isolation and are warmed by the fires of our interconnection. For this moment, this radical moment, we find a certainty within the knowable bounds of love and community. Spirit of love and life, we gather together in different ways this morning, from computer screens, from telephones, from car radios. We gather, reaching out across the wires, waving from a safe distance to come together in religious community. From living room to front porch to car seat, we gather as we're able, ready to be of service to each other, to the world, ready to build a community of hope and love. And we face this bright morning. We are apart, but we are together, offering our love, our commitment, our hope, and our prayers in service to one another and the world. It's a new way, but an old way, that we come together in worship today. Apparently there were no joys and concerns that were sent into the church, and so I'm asking that we think together silently, each in your own way, to think of people who have given so much during the last few months, selfishly and kindly, and spread love among us in a very difficult time. Perhaps you could send a prayer or positive thoughts to a hero that you know personally. Doctors, nurses, medical staff, long-term care providers, the residents and their staff, and their families, postal workers, media people, grocery store workers, students, teachers, and the staff that support them, artists, performing and all artists, people in the hardware store, people in restaurants, and the demonstrators, the auto repair shops, there are government workers that are still working to try to inform us and keep us safe, particularly those who are alone and possibly afraid. Let us reach out and send love to all. We'd like to thank Trish Moore for providing these beautiful flowers. I think I said her name is Tish, and she'll call me and tell me. Thank you, Lisa. In 1971, my first husband, Ron Biddle, and I came along with some friends and started a company called EduPlay. We saw a great need for quality childcare, and over several years built and developed several childcare centers in Louisville and surrounding area. The first year, our 3-year-old children were under 5 years old and went with me every day to the brand new building. I very quickly learned how to hire and fire and supervise some very dedicated women who shared my values in the importance of good, safe preschool education. I learned how to set up curriculums, collect fees, write bank deposits, order food, cleaning supplies, educational and playground equipment, managing staff schedules. We were open from 6 a.m. to midnight several nights a week. We learned how to deal with the varying licensing agencies and dealt with problems in public relations, and generally managed the running of the center. And I'd had no business experience. Like most young mothers, I took my precious little children home every night, fed them dinner, traded stories with them, and read them their favorite books before bedtime. Several years later, there was a recession, and attendance at the child care centers declined. because so many of our clients lost their jobs or found family members to care for their children. So the company shifted focus, and we built and opened several nursing homes. Eventually, all the child care centers were closed, and I felt like I'd lost a part of my soul. By then, my bright and beautiful children were in elementary school, and I was divorced. I was offered a position at Rockford Lane Nursing Facility in Shively as social service designee and activities director. I took the job, and every evening, my children and I continued our habit of getting back together, sharing dinner, and trading stories of our days. Eventually, I was transferred to Jefferson Manor and Jefferson Place, where I became director of admissions. When Jefferson Place opened, I was there, and I moved there worked with the new families, friends, residents, and staff. It was our goal, under Debbie Bell, to offer beautiful, safe environment, excellent services, and choices for residents, and assurance to families. When my daughter, Lisa, who you'll meet again in a minute, she went to college, she majored in family communication. When her father's mother and grandmother became very ill, she moved nearby so that she could care for them. Now she's going to tell you the rest of the story.
Thank you. Yes, I grew up with a dinner table that talked a lot about care, as you just heard from my mother. When I was pursuing a PhD in family communication in my early 20s, as my mother said, I did come home to care for my grandmother and great-grandmother on my father's side. They were mother and daughter and lived together. During that time in my life, I had a pretty significant, well, I guess they're all significant, epiphany about who I was. And that happened during a hospital visit with my great-grandmother when she was quite ill. Frankly, she was having a pretty horrible, wretched episode of vomiting. And I remember being a young kid and thinking, oh goodness, I hope someone else can step up and help her. And when other members of the family came in who had been older and raised children, I remember thinking, oh good, they're going to go help her through this. They stepped backward, and I stepped forward. And I knew at that moment that it was my mother's spirit that pushed me forward to be a nurturer. That's really who she and I are, and frankly, who most of the people who work in long-term care are. When it came time for me to find a career, that made sense for me, even though it wasn't really on the horizon when I was in grad school. I did care for elders immensely, and it was something that truly fed my soul. As nurturers, I know it feeds my mom's soul and mine, and again, it makes a lot of sense for us to make connections based on care. Right now, I am the administrator at Nazareth Home Clifton and have been for 5 years. But frankly, I've been in this business profession, I like to say, for 25 years. So I have some expertise on this, and I want to talk to you all today about long-term care. I want to talk to you also about it because it's important that you understand that right now the Centers for Medicare and Medicaid actually say that 60% of people over 65 are going to need long-term care, and 40% will need nursing home care. So I'm going to talk to you first about types of care. I'm also going to talk about paying for care, and I'm going to talk about quality, how to find quality, what those measures are. And then today I'm going to share with you the impact of COVID-19 on our profession. First, I'd like to talk about types of care. A couple of types of care, residential and medical. And first I'm going to talk about residential, where there's not quite so much medical assistance or help, but independent living is really the entry level of a type of care for seniors. It's a residential setting that basically allows elders to live in a home without having to worry about home maintenance. Sometimes there may be, because of the fact there are other elders around, there may be activities and fun things to do. Assisted living is really the next level up, and while it's still not medical, assisted living can provide more care. They are going to provide activities, dining, and housework, but they can also do some help with bathing, dressing, grooming, and can give medication reminders. One thing that a person would need to do to live in assisted living is to be able to get out of the building that they're in the event of a fire in a timely manner. So there are things that can be offered, but a person who lives there has to have a functional status that allows them to be able to get out of the building during the event of a fire. Medical model includes other levels of care. First, personal care. In this case, rather than just having someone come in and give a medication reminder, this allows for employees to give elders medication, actually do the administration. In this case, you also have to functionally be able to get out of a chair without very much assistance from another person. So you still have to be able to function pretty independently in personal care. And most personal care places already offer the same kinds of things that assisted living does. I say this, sometimes there are regulations that delineate the different types of care, but a lot of times the levels of care overlap. So sometimes someone could be in multiple levels of care, just depending on the type of center. Most facilities don't offer all levels of care. There are some who offer a continuing level of care, but it's pretty unusual that you find one campus. The next level of care up is skilled nursing care, and that's first off what a lot of folks think of as long-stay care, which used to be considered nursing home care. But that's more than personal care when a person needs more help than that. But another thing that's becoming much more important for lots of us in the community is that skilled nursing care often provides a short stay rehabilitation or recovery to home after a hospital event or an illness or a surgery. So there are a couple of different types of folks who are living in a skilled nursing center. Those who are staying for long stay and those who are there for short stay, not making it their home. Another level of care is memory care, and that's a special focus on dementia care, and a lot of times memory care has a secured unit, a locked unit, that is to help elders who may have confusion and not be safe to step outside on their own. Next, I want to talk about paying for care, and a couple of ways to pay for care. On short stay, Medicare Part A is usually what folks consider is there for hospital coverage, but it also covers skilled nursing care, and that's what I was just mentioning, that short stay recovery to home in a skilled nursing facility. Medicare Part B, with a deductible, will cover physician visits, labs, therapies, and ambulance visits. Medicare Advantage is actually very similar to Medicare, but that's when a private insurance company provides care similar to Medicare when a person decides not to have Medicare and elects to go with another agency. The coverage is not exactly the same, but it is similar. It's supposed to be pretty similar. Next, for long stay, really there are a couple of options. You're going to pay out of pocket for long stay care unless you're eligible for Medicaid. And Medicaid is a form of financial assistance that's available for those who meet the financial criteria. But there also are some medical necessity that need to be met in order for Medicaid to take care of a person's expenses in a nursing center. Basically, the way Medicaid works is that Medicaid will cover the balance of care after a person's monthly income is given toward the nursing center, and that person is allowed to keep $40 a month for personal expenses. Now I'm going to talk about quality measures and how we might make the best decision if we're looking for nursing facility care. And one of those ways to check out quality is to look at the Medicare.gov website. There's a page for Nursing Home Compare, and on that page, it actually will allow you to do a search for the area that you're in, and you can look for your zip code, put in a radius of space, and you can find out about centers in your area. They'll give a 5-star rating to all of the centers that are participating with Medicare. And basically the way that works is that overall there's a formula that tries to compare centers with their peers across the nation and the state. 3 stars is an average center, 5-star is the highest rating. There also is based on a health inspection. Every year, at least, every center has an unannounced state inspection or possibly a federal inspection. Frankly, long-term care is, we've said this for many years, but true, the most regulated profession aside from nuclear power. So we do have lots of regulations, and because of that, we also have inspections to make sure that we're following those guidelines and keeping our elders safe and healthy. Those results of health inspections are included in this Nursing Home Compare website. If you want to take a look at the results, do that, but I urge you to speak with the center that you're considering. Ask questions about that result, especially if you see concerns about it. It could be that if there was a problem, the problem has been resolved, but you want to talk with the center and find out how they've resolved it, and the way that they communicate, I think, will tell you a lot about the quality that you're going to be experiencing when you have your loved one go to that center. Another part of the rating is staffing, and staffing has a lot to do with quality. In this case, Medicare gets information from payroll records, and that data is shared, those data are shared up with this website so that we can compare staffing to national and state averages and see where that facility lands. It also looks at not just direct care staff or people who are providing direct care, but licensed staff, including RN coverage, is covered on this staffing measure. There's also another group of measures for quality, one set for short stay and one set for long stay. As I mentioned, a couple of different types of folks might be in those centers. Short stay measures of quality can include preventing a rehospitalization that might be unnecessary and frankly dangerous to an elder because of the potential for infection if a person's already been in the hospital and needs to go back. Another measure is the successful discharge to the community. If someone's plan is to go back home into the community, there's a measure of the percentage of success with that. For long stay, there are measures that have to do with preventing infections, helping someone stay functionally as independent as possible, or things like clinically preventing skin breakdown. Those are all measures that you can take a look at if you look at this Nursing Home Compare website. So this is an important way to look for quality. Ask questions, though, of the center you're considering. Okay, next I'd like to just say that another really important measure of success is customer satisfaction. And if you know someone who's had an experience in a center, that's often the best source of information. Unfortunately, customer satisfaction data right now are not publicly reported, but centers who are really good do definitely measure customer satisfaction. So ask, what are their customer satisfaction scores if you're considering a center? Many of our centers upload data in order to compare our results on customer satisfaction to others across the state and nation. And again, a good nursing center should be able to answer those questions. Ask them for their scores. So now I'd like to talk with you a little bit about something which has been, frankly, pretty personal, even though it's been widespread across our profession. That's an image right now of Nazareth Home Clifton, and we're lit up in green. We're lit up in green to show compassion, as I know many of you have been showing at your homes. I want to tell you a little bit about what's happened in nursing centers since COVID has impacted us. And unfortunately, since March, our elders have not been able to have visitors from their loved ones. Meals, activities, and trips to the community have been restricted. Within our centers, frankly, for the last several months, we've had challenges getting personal protective equipment. We've had challenges getting testing to happen soon enough. We've certainly had fewer folks choose to come to our centers, so of course that's going to mean revenues are extremely down. When we're not a money-making business as it is, we're a profession that's here about providing care, and most of us are providing care to folks who are getting Medicaid and financial assistance. It's also been really hard to recruit new staff, as you could imagine, during this time. So I want to tell you a little bit about what's happened at Nazareth Home Clifton and to me. The week of Mother's Day always starts an important celebration in our profession, and that is the National Skilled Nursing Care Week. Actually, this year we celebrated sharing our wisdom, and the emblem for that was trees with leaves. And right now, I see trees with leaves all around the sanctuary with me. So I want you to know this is an important message for me as well. We were celebrating National Skilled Nursing Care Week 6 feet apart from one another with masks on. We were doing so with a closed circuit TV, kind of like you all are here. And we were having window visits with families. We were using social media to stay connected. And essentially, we were finding this opportunity to celebrate healthcare heroism. Lots of times we were noticing how much hospitals were celebrating their healthcare heroes. Well, our long-stay heroes were working just as hard, if not perhaps harder, because of the lack of resources that they were experiencing. That week ended with a Saturday where we did have one of our elders need to test positive. That elder was having some respiratory symptoms, and frankly, folks mostly presumed that this was because of some swallowing problems and not because of COVID. But we did test because we have a pretty low bar to test to make sure that we can rule that out. Testing was not very easy to come by in the middle of May, but we did so. That night, the middle of the night, on a Saturday night in the middle of May, we did get a positive test result for that elder. And we put our emergency preparedness plan into place. All centers are required to have emergency preparedness plans, including a plan for what to do in the event of a pandemic. Basically, what that meant was that the director of nursing and I went in the middle of the night. We grabbed a whole different set of personal protective equipment, some of which you can see here. We re-educated our employees on the personal protective equipment that they'd been trained on, but some of which they'd never used before. And we had to create a separate space for the one elder who needed 2 people to care for that person away from all of the other elders. So basically it was generating a whole new space. By the next day, on that Sunday, unfortunately, we had 2 more elders who had symptoms. So we were on a phone conference with the Louisville Metro Health Department and the Kentucky Department of Public Health as well. At that point, we had already been scheduled for facility-wide testing and had been one of the earlier centers to volunteer to go first, but we pretty much begged to get the testing date moved up sooner, and the soonest we could get the testing to occur across our entire center was by that following Wednesday, May 20th. By that point, 3 other elders had symptoms, and we were struggling with the test kits, not making it quite as early as we'd hoped, but we did successfully test the entire center, all of our employees, all of our elders, and we were successful in getting those tests. The next day, we did have an inspection, a special inspection to make sure we were doing what we needed to with regard to infection control and COVID. That inspection for 2 days resulted in 0 deficiencies and a reiteration that we'd been doing all of the right things. Frankly, we'd been pretty early adopters of taking on some restrictions before it was required for us to do so. We'd also been working since January to save on PPE because we'd been seeing about the news what could be coming. While others weren't doing this, our center was working hard to be ahead of the game. However, after we got a 0 deficiency survey late Friday night, we got results back from the tests. 29 staff were positive, including nurse leaders, social worker, maintenance, the director of nursing. One of those people who was tested positive was someone who had been working so hard day and night. She and I had been putting in so many hours in order to try to do our best to keep this horrible virus away from our elders. Unfortunately, 33 of our elders tested positive. It was pretty overwhelming. I don't think that the health departments were prepared for these numbers. We had been asking them, what do you expect? And they didn't know what to expect. This was early on when facility-wide testing was happening. At that point, though, our state celebrity epidemiologist, Dr. Spicer, was very helpful and involved, and he helped decide where, with a facility layout, a vision of a layout, where we were going to separate groups of our elders so that they could stay together. People who were positive with other positive people, people who were negative with other negative people, people who had potentially been exposed but not positive together, and those with symptoms but testing negative together. So we had to pretty much shift the entire layout of our center. And that next morning, we had to move 40 elders from different rooms. And in my career of 25 years, I'd say moving 5 folks in a day would be phenomenal. 10 would be almost unheard of. Moving 40 people in a day without nurse leaders, without a maintenance guy who's burly and used to helping us, and without so much of our staff, seemed a near impossible task. But that's what we did. We donned our PPE, we used our special disinfection processes, and we frankly did get some assistance later in the day from the county emergency management team. We did have firefighters and EMTs help us to physically move the elders from one place to another. I'm not going to say that was easy, and I'm not going to say it went the best. It was very chaotic. It was hard on our elders. We didn't have as much time as we would normally have had to explain all that was going on, and to provide, frankly, the nurturing that I would have wanted to provided to the extent that would have been best. But we did the best we could. We got all of those folks moved. And frankly, that was also a day that we had a lot of employees begin to be extremely anxious. They were having very strong emotions about the anxiety they were facing and a lot of loss of control. This was the toughest day of my 25-year career. Monday, Memorial Day. Unfortunately, we were really struggling. By that point, we had 5 elders who had gone to God. We'd had some really tough experiences with our staff. When a funeral home would come, unfortunately, they would not be able to come into the building, and the funeral home was asking our staff to do some things with our elders' bodies that we felt very uncomfortable with, that were not very compassionate. Again, I think there's just a lot of fear, a lot of unknown. Our staff was being asked to help put someone in a body bag when that's never been a part of a job description. More staff were calling in. Fear was a part of it, but symptoms were happening for our staff as well. And we knew that Memorial Day, by the afternoon, that we would not have enough staff on the Tuesday following that in order to provide care safely for our elders. So I got on the phone with government officials expecting that those strike teams that we heard about on the news would come in and help us with this, or the National Guard. Little did I know that the National Guard at that point was really not an option for us, as they had been in other cities across the nation because of the demonstrations for racial justice. We did get a strike team available, but it wasn't going to be enough to help us provide safe care for our elders. And we were advised that the safest course of option would be to transfer the elders who tested positive to local hospitals. We did so. We had an hour and a half to prepare to transfer all of those elders out. We had, at this point, only 4 administrative team members. This was a holiday, and it was the end of the day. There were not many of us left standing. We did also have some hospitals who were pretty restrictive about what types of elders they could have. So it wasn't just an easy, the first 4 people are going to go here, the next 10 are going to go here. We had to look at the acuity level of the elders and make important decisions about where they would go based on the hospital desires. But in an hour and a half, we met the team at the door of the same EMTs and firefighters that we'd seen 2 days prior, and the emergency management came. We were, frankly, needing to huddle in prayer from 6 feet apart with our PPE on, but we did huddle, and we decided that we'd do the best we could with this very difficult experience. It was important to me personally, as the administrator, as each elder passed, usually on a stretcher, to head out to a hospital, to give my own personal expression of love and compassion. We also made sure we had lots of systems in place to make sure that all of the records went out with the elders, and to make sure that everything that the hospital would need to take care of that elder to the best of their ability would be available to them. That became by far the toughest day of my entire career, 2 days after the first. I will say, 9 days later, I had a tougher day. I had an employee go to God as well. This employee had tested negative in the facility-wide testing. We didn't know that this employee was not doing well until we heard from the family that this person was in the ICU. Later, we realized this was an employee who had run out of the building that first Friday night in fear that she would catch this virus and take it home to her family. And we had coached her with all of the information that we had to try to make sure that she understood that using the precautions that we were advised to use would keep us safe. This employee was 6 months younger than me, so personally, this was pretty hard. Overall, my experience with COVID has brought me close to actually 77 cases of COVID. We've had a total of 44 elders and 33 employees experience this virus. There have been 17 deaths. 30 employees have terminated for some reason or another, whether it had to do with fear, child care, or something else going on. Our census has dropped by half. It's been traumatic for our elders, for their families, and for our employees. And personally for me, I worked many, many days with no days off. And these were long, long days. I lost a lot of sleep. And part of this is many of us who've experienced this are having nightmares when we sleep. Worst for me was that my daughter, a teenager, decided to move out to be with her father while this was going on because she too was afraid of this virus. So I came home after long, long days to a dog who loved me unconditionally. But I also had to protect my dog. So as I would dash in the house, I'd have to undress at the door and run to the shower before I could even greet the dog. And of course, she didn't understand that, but I was protecting her. We've experienced, all of us, some post-traumatic stress. I will not forget the faces of the elders who were leaving for the hospital, some of whom did not return. I will not forget the voices of the families who were not able to see their loved ones through this COVID. And I will not forget the persistent worry of the employees who've been afraid and feeling guilty that we'd followed the guidance that we were supposed to follow, and all of this still happened to us. We were not prioritized for testing. We were not prioritized for personal protective equipment. And the fact that this virus has had more than half of our folks be asymptomatic has made this a significant challenge. The layout of our building has been extremely challenging. We've had multiple entrances, which make screening folks quite a bit harder to do. We have a traffic pattern that takes people through living spaces. So we've had to make a lot of changes with our center because of the building layout. Just the nature of the people who work in long-term care makes this a challenge for us too. People who are caregivers in our centers are often very diverse ethnically and often have many folks living in their homes with them. Many times they rely on public transportation, and most of our employees are not comfortable with the health system that we have in place. It's not accessible to them. They're not accustomed to practicing the best health practices because of their lack of access and comfort with our health system. Even the best nursing homes with the most rigorous standards cannot stop this highly contagious and invisible virus. I want to say that in dealing with our residents and our families and our staff, by far, for me, the most resilient group of this has been our elders. We've been communicating with them a lot. Communication has been so important with all of these groups. Repeating what we say is extremely important. But I'm really pleased that our elders have coped so well with all of these restrictions. Our staff are struggling. Our families are struggling. It's important for me that I provide a counter argument for any kind of guilt that folks are feeling, any kind of shame that something that we've done wrong may have contributed to this virus, when really it's been random bad luck for us. It's really important for me to check in with everybody on a regular basis to see how they're doing, to give positive affirmation more than usual, but also to do a lot of education about stress response, to give people space to feel their stress, and to help them to debrief and talk about what's happened to them, but to do so in ways that don't provide so much re-traumatizing or reliving of gory details, as often we're apt to do as human beings. We want to be aware that when we're sharing stories that we limit our disclosure or we give a fair warning about that. It's been really important for me that we provide meals to our staff and our residents. Meals and snacks have come to be more important than ever. And frankly, for me, fluids were more important than ever because of wearing personal protective equipment. It's been important for me to check on staff who've been sick. If they've been out sick, I want them to know that I understand the emotional stress that comes with being sick. But I also have needed to re-educate people about what it's going to be like when you come back into the center after you've been sick. I had to re-educate people about the fact that we had some parts of our centers that had lights off because we didn't have enough elders living in them, and that when you come back to work, it's going to feel a little bit different. I've also had to re-educate people who've been afraid after they've tested positive and are getting ready to come back to work. They're afraid that they would bring the virus home to their families, not understanding that they've already been at home with their families. We've had to educate co-workers who were not out sick and help to try to avoid some tension between the group that stayed at work and was not at work, to make sure that there's no stigma about the disease when people return, and to make sure that we understand what it's like for people who have not been there for hard times to feel somewhat left out from that. So it's been important to give staff a voice. What's really been important for me is that as a leader, I know I need to take care of myself. That notion of that oxygen mask that we have on the plane has been really important. Avoiding burnout has been important, and avoiding secondary trauma from watching too much TV has been a pretty big deal. There were moments when I'd be pretty frustrated driving home from work down Frankfurt Avenue, and I'd pass by a bar and see lots of people without masks, singing and right next to one another without social distance. And I remember being pretty angry. That was pretty traumatic for me. I had to manage those reactions. I've had to remain calm and try to be patient and tolerant. It's been important for us as a center as well to memorialize the loss that we've experienced. We've had some ceremonies with candle lightings. We've done a lot of bell ringing. We wear green every Friday to symbolize our compassion and our hope for renewal. We're looking forward to a tree planting and a dedication of a bench. It's been really hard on Nazareth Home Clifton and me, and those of us who work with our elders, but we're really proud of what we've done. I want to let you know that just this past week, there was a national survey that came out to long-term care centers, and at that point, the information came back that says that 72% of long-term care centers do not believe that they will be able to sustain themselves over the next year with the situations as they are. 40% are unlikely to last 6 months. That could be tragic. I mentioned earlier that 60% of us over 65 are going to require long-term care at some point, and 40% will need a nursing home. In the year 2030, we're going to reach a milestone in U.S. demographics. People who are over 65 are going to outnumber those who are 18 and younger. 1 in 5 Americans will be at or past retirement age. We need long-term care centers in order to provide care with nurturing and compassion that all of us know would be the right thing to do for folks. To conclude, I just want to let you know that I hope helps you to understand a little bit more about your options for long-term care for yourself or someone you love. And while I know that my description of COVID's impact has been difficult because it has been brutal on our centers, I hope you have some insight and compassion for those forgotten heroes in long-term care. We do get a lot of tough knocks sometimes from those attorney commercials that make that mistaken impression that there's more abuse and neglect occurring in nursing centers than there is in the private homes of elders. Making sure that elders are cared for in a safe and healthy manner is our top priority. I'm proud of the many in long-term care who've pushed to do the right thing to protect and love our elders. What you can do is you can follow the COVID precautions that are out here. Also, support those who are living in long-term care and their families through this tough time. And encourage those who work in long-term care. When you have the opportunity, encourage our government to provide more resources in order that the legacy of nurturing and nursing care can continue. Thank you.
I don't know that I can sing after that, but I'm going to give it a shot. I'm a second alto, and of course we haven't had any any rehearsals, and I haven't been singing for several months. So my dear sister Irene has agreed to sing with me, but my great hope is that you all will sing at home and not hear us. We're going to sing "Let There Be Peace on Earth," and I think everyone knows the words. So please join in, and we sing this song from our hearts and our souls in a time of difficulty. Alice, I would like to thank Charlie and Brody, who are working the cameras and the microphones, Nina for playing the piano beautifully, Marcia, who's helped me set this up, Irene for singing with me, and of course Lisa. Let me find peace within, so that I may find calm without. Let me find silence within, so that I may find compassion without. Let me be reminded that some things are worth waiting for. Let me be reminded that the journey is more important than reaching the destination. Let me see that non-doing is as much a part of life as is the doing. Let me be reminded that it is in these moments of holding on that I can find quietude and renewal. It is within these times of inaction that I can find rest. It is in these times of emptiness that I can become full.